this, and I'm going to demonstrate to you how to take your blood pressure. We have discussed before, and other CIs have discussed before, all the procedures that we will be doing during our vital signs. We have your BP, pulse rate, RR, and your temperature. In which that and temperature and the RR was already discussed previously. So, with the same preparation, in your procedure, you have to introduce yourself and verify the client's identity. Carry all the things, your instrument going inside the room of your patient. You have to knock the door, and then you enter and you have to introduce yourself. Good morning, ma'am. With your normal smile. Good morning, ma'am. I am Mrs. Fernandez. I am here to get your BP for you and your pulse rate. Okay? So, after introducing your identity and verifying, what is your name, ma'am? Verify the client's identity. What's your name, ma'am? Okay? You have also, because at times, especially in other countries, they have all the same names, but different person. Okay? So you have to also check the identity of your patient if they have the ID. Okay, then explain why BP is taken and why it is. Okay, perform your hand hygiene. Hand hygiene is will reduce your transmission of the microorganisms, and after that you have also to provide privacy. My patient is in a single room, so it's only her in the room. But if your patient is in a ward, you have to close the curtains. Okay? So as to minimize or avoid embarrassment of your patient. Okay? Position your patient. Now I am positioning my patient in a sitting position, but if the patient cannot sit, he or he will just be staying in the bed. Okay? Otherwise, it's specified that your patient will only be on the bed. Okay? So, moving to the client, you move the client's shirt upper of the aspect arm, okay, of your patient. Okay, this is yours. This is yours correct taking of your blood pressure. Positioning the patient's arm. Okay, positioning the patient's at the heart level and extending with the elbow, which should be slightly flexed, and the forearm supported at the heart level. Okay, so I'm going now to place the BP cup to the arm of the patient, in which it should be occupying 2/3 of the arm of your patient. Okay? 2/3 of the arm. This in the antecubital area. Okay? It says in the artery of the antecubital area. Okay. So you have to wrap around your BP cup into the arm of the patient, making it snugly fit, which is not too tight or not too loose. Okay? Not too tight or not too loose. Okay. In that you could insert your fingers. Okay? Why? Why should not be too tight or not too loose, so that it will not give you a false reading on your blood pressure. So you're going to fix. Okay? And then, after positioning your client's arm, okay, and wrapping your cuff of the BP apparatus status evenly into the upper arm and applying the bladder directly on the artery. Okay, why? This will have a accuracy on it. Okay, and this, it will also prevent your auscultatory gap. And then, palpate for the brachial artery with your fingertips, closing the bulb of your bulb, okay, the bulb or the screw, okay, because if you will not close this bulb, even you will pump in here, the bladder will not be inflating. Okay, so you are going to close this very well, close it, okay, going right, and then you have to place your fingers, palpating the artery, okay, so at times, if the patient is a little bit fat, okay, you could not palpate it well, okay, so my patient has a good pulse, okay, so I'm going to pump my bulb, okay, until to the last, okay, until to the last highest brachial pulse. And I have taken a 110, and then slowly deflating or opening the bulb of the bulb or the screw so that the pointer will go down slowly. Okay? And then, after you have taken the brachial pulse, okay, and you have not heard already the brachial pulse, you have to note the pressure on the sphygmomanometer. And then release. I have released it completely. You should release it completely and wait for 1 to 2 minutes. Okay, for a further re-measurement. This will prevent your venous congestion and false reading again. Okay, then you are going to position your stethoscope. Okay, before using, it should be clean also. This cleaning your stethoscope microorganisms to harbor. Okay, and so you have to again with the stethoscope. You see the angle, it should go in, like that, not like that. Okay, it should be like that. Okay, so you have to insert it in your ears, placing the bell or the amplifier of the stethoscope here. Okay, we have the diaphragm and we have the bell. Okay, you see the angle of the stethoscope. If the angle faces in that part, that means the open is here. But if it will go on like that, you see, the opening will be in here. Okay? After locating which is the open on the stethoscope, you have to place the stethoscope direct on the skin of the patient, not on the clothing. Okay? And holding the diaphragm, okay? Holding the diaphragm with your thumb and with your fingers, auscultate, okay, the client's blood pressure. So, you are going to pump again, closing the valve and pumping it so that the bladder will inflate and the pointer will go up. Okay. I have taken a while ago with my brachial pulse as 110, so I will plus 30. I will add 30. So 110 plus 30, it will be 140. So I will end up
begin pumping the bladder until 140 only. Okay. Then, slowly release patient's blood pressure. From the first chant, that is your systolic, and to the last chant, which will be your diastolic. Okay. After that, after releasing the valve, okay, you identify, okay, the manometer reading at the periscope phases to 1, 2, 3, and 4. Okay, defining the cuff rapidly and completely. Okay. Okay. Repeat the above steps once or twice if necessary. Okay. And repeat the procedure on the client's other arms. Okay. And then you are going to remove the cuff of the, you should remove it immediately, okay? Because it will tighten up the arms of your patient. It's painful also. Sorry, ma'am. Okay? After that, after removing the cuff of the BP apparatus into your arm of your patient, you are going to wash your hands again, and then you are going to document and report any pertinent assessment data. That is all for our BP apparatus, and thank you very much for listening. Thank you, Mom.